What if one day you could not feel pain at all? Sounds good, right? But without pain, many people would die from simple injuries. Pain is the reason most people go to the hospital. But what if I tell you, pain is not just pain. Sometimes pain protects you, sometimes it lies to you, and sometimes it continues even when the injury is gone. Today I will explain pain using real cases in simple way that every student and patient can understand. Welcome to the channel. This video is not about complex medical terms. It is about understanding pain, what it is, why it happened, why doctors treat it differently in different patients, and basic pain terminology. Pain is not the fire. Pain is the fire alarm. Imagine a house with a fire alarm. One day, the alarm starts making a low, irritating sound. Not loud, not urgent. The owner says, "It's probably nothing." He removes the battery so he can sleep. The next day, the house is silent. The fire is still growing. Pain works the same way. At first, pain is mild. Then it repeats. Then it changes. If ignored, the body stops warning. And damage continues quietly. Pain is information, not punishment. It exists to protect, not to torture. Pain does three jobs: detects a problem, directs attention, demands action. When pain is ignored, the problem doesn't disappear. Only the warning does. Doctors don't ask, "How strong are you?" They ask, "How long has it been there? Is it new? Is it repeating or changing?" Because duration and pattern matter more than intensity, pain is your body speaking in advance. Listening early is intelligence, not fear. Pain is defined by the Revised International Association for Study of Pain, IASP, as an unpleasant sensory and emotional experience associated with, or resembling that associated with, actual or potential tissue damage. Let us break this definition into simple, understandable parts. Unpleasant experience pain is always uncomfortable or distressing. If an experience is pleasant, it cannot be called pain. Sensory and emotional pain is not only physical. Sensory means what the body feels: burning, stabbing, aching, or throbbing. Emotional means how pain affects the mind: fear, anxiety, stress, or suffering. This explains why two patients with the same injury can feel very different levels of pain. Actual tissue damage. This refers to pain caused by real injury, such as surgery, trauma, burns, inflammation. Here, tissue damage is clearly present. Potential tissue damage pain can occur even before injury happens. It acts as a protective warning system. For example, pulling your hand away from a hot object before serious injury occurs. Resembling tissue damage pain can exist even when no injury is visible. Examples include neuropathic pain, phantom limb pain, chronic low back pain. These pains are real and valid, even if tests or imaging are normal. Why this definition is important. Pain is subjective. Pain is not equal to injury. Emotional and psychological factors matter. Absence of tissue damage does not mean absence of pain. This new definition helps us respect patients and improve pain management. Pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. Pain and nociception are different phenomena. Pain cannot be inferred solely from activity in sensory neurons. Through their life experiences, individuals learn the concept of pain. A person's report of an experience as pain should be respected. Although pain usually serves an adaptive role, it may have adverse effects on function and social and psychological well-being. Verbal description is only one of several behaviors to express pain. Inability to communicate does not negate the possibility that a human or a non-human animal experiences pain. A central change in the new definition, compared to the 1979 version, is replacing terminology that relied upon a person's ability to describe the experience to qualify as pain. The old definition read, "An unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage." This wording was interpreted as excluding infants, elderly people, and others, even animals, who could not verbally articulate their pain. Subscribe to Vigilant Tube and learn with purpose. Clear education, safer practice. Vigilant thinking. Pain terms allodynia pain due to a stimulus that does not normally provoke pain. Note: the stimulus leads to an unexpectedly painful response. This is a clinical term that does not imply a mechanism. Allodynia may be seen after different types of somatosensory stimuli applied to many different tissues. Example: pain from light touch or clothing on skin, analgesia. Absence of pain in response to stimulation which would normally be painful. Or reduction or absence of pain without loss of consciousness. Hyperalgesia. Increased pain from a stimulus that normally provokes pain. Example: severe pain from a small needle prick after surgery. Hyperesthesia. Increased sensitivity to stimulation, excluding the special senses. Multimodal treatment. The concurrent use of separate therapeutic interventions with different mechanisms of action within one discipline aimed at different pain mechanisms. For example, the use of pregabalin and opioids for pain control by a physician, the use of NSAID and orthosis for pain control by a physician. Unimodal treatment. Single therapeutic intervention directed at a specific pain mechanism or pain diagnosis. For example, the application of exercise treatment by a physiotherapist. Nociception, the neural process of encoding noxious stimuli. Nociceptive neuron, a central or peripheral neuron of the somatosensory nervous system that is capable of encoding noxious stimuli. Nociceptive pain. Pain that arises from actual or threatened damage to non-neural tissue and is due to the activation of nociceptors. Nociceptive stimulus. An actually or potentially tissue-damaging event transduced and encoded by nociceptors. Nociceptor. A high-threshold sensory receptor of the peripheral somatosensory nervous system that is capable of transducing and encoding noxious stimuli. Nociplastic pain. Pain that arises from altered nociception despite no clear evidence of actual or threatened tissue damage causing the activation of peripheral nociceptors or evidence for disease or lesion of the somatosensory system causing the pain. Noxious stimulus. A stimulus that is damaging or threatens damage to normal tissues. Before we end, remember this. Pain is not just a signal from injured tissue. It is a message created by the nervous system. That means if we truly want to understand pain, we must understand how pain travels, from the point of injury, through nerves, into the spinal cord, and finally to the brain. And that is exactly what we will cover in Part 2. In the next video, we will break down the pain pathway step by step, simple, visual, and clinically relevant, so you will finally understand where pain starts, how it is transmitted, and where we can block it with anesthesia and analgesics. If this video helped you understand pain terminology clearly, like this video so more learners can benefit, subscribe to the channel for structured medical education, and turn on notifications so you don't miss Part 2 on pain pathways. Drop a comment below and tell me, which part of pain confuses you the most? Receptors, nerves, or the brain? Until the next video, keep learning, keep questioning, and remember, better understanding means better patient care.